You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have Dr. Diana Rodriguez. Dr. Rodriguez, welcome to the program.
Thank you, Randy. Thank you for having me.
Good. Now, I know you brought some photos, so we'll get to those. Now, for people that don't know your practice, I guess this is like your focus is replacing missing teeth with dental implants. So who's the typical patient that you see?
We don't really have a typical patient. It could be anyone that is missing a single tooth, multiple teeth, a denture wearer, someone that's unhappy with their current denture because they have to use a lot of the denture glue, someone that might be soon losing all their teeth and going into a denture. So we really see everyone from all different walks of life. And I'm a general dentist, but really the focus of my practice is mini dental implants.
Now, we should mention that what we're talking about today, you teach other dentists. You lecture on this topic.
I do. So the guru of mini dental implants is a doctor up in Buffalo, Dr. Todd Chackin. He's who trained me on this procedure. And now I help him train other dentists on mini dental implants.
So this is like the hottest, newest thing in dentistry?
Well, it's not really a new procedure. It's a procedure that's been being done in dentistry for the last 20 years, but a lot of people just don't know about it, Randy. So that's why I love doing shows like this, because we get to teach a lot of people and educate them and let them know that there's hope for all those people that have been told that they don't have enough bone, or for the people that hate their denture. Now there's hope for those patients.
So in New Jersey, are there a lot of people wearing an upper or lower denture?
There are, Randy.
Or headed to dentures?
There are a lot of people that I could fill MetLife Stadium many, many times with people that are wearing dentures or people that are headed to dentures.
Okay. If it's so good, right, these mini implants, what's your take on why they're all not doing it?
They don't know about it. And that's why I love doing shows like this. Most people think that there's no hope as denture wearers. They have gotten used to their denture. They've just adapted to it. And they really think that there's no other option. Randy, if you're wearing a denture, you haven't been in to see the dentist in maybe 10, 15, 20 years. So you've just adapted to your denture. You think there's no other option.
So they don't know their options.
No, and they just, every morning they get up, they put in that denture glue, and they think that that's really the only way. What the denture wearers don't know, Randy, is that literally in just one afternoon, on the day of the procedure, they can come in with their poorly fitting denture and leave that same day, just a couple of hours after the procedure, and they have permanent teeth.
Is that right? So now these are FDA approved.
It's FDA approved, it's ADA approved. The science is overwhelmingly positive for mini implants. The success rates with traditional implants and mini implants are equal.
But I've had qualified dentists on the program, on this desk, that say the problem with mini implants is they're too small. They don't work. They're not quite there yet. There's not enough research. What's your response to that?
That's not true, Randy. There are many studies out there. Todd Chackin, the guru of mini implants, did a 10-year study. It's now been 12 years since that study was done, and the success rates are just about equal.
Okay, so you do. So this is. You do this every day.
I do this every day. At least one patient, if not, 2, 3, 4 patients. Back to your original question. Let me tell you about the life of a denture wearer.
Okay.
Prior to being in a denture, they had maybe 10, 15, 20 years of back and forth to the dentist. Maybe they had a root canal, a failed root canal. The tooth had to be removed. Then they needed another root canal. And it was just constant back and forth pain, nickel and diming. All this money was spent. And when they have finally no longer have their teeth and they're in that denture, they're relieved. They think, finally, I'm not going to have to be going back to the dentist anymore. I got rid of all my teeth. And what they don't realize is that they are now going to have this mashed potato and soup diet. The denture is going to be moving. They're going to have a loss of confidence, loss of self-esteem. They're not going to be going out to eat. They don't want to socialize with their friends.
Do you hear this from patients that are wearing dentures?
All the time.
Because I know a couple of denture wearers. They never complain.
They don't complain to you, Randy.
Okay.
They're in my office every day telling me how poorly fitting the denture is, how they just don't feel confident, they don't want to socialize, they no longer date, they don't want to kiss anyone with confidence. I had this one patient, he came in and what he first said to me was that he wanted permanent teeth. He said to me, I'm just fed up with these partials. He had a whole collection of partials that he wouldn't wear. He would just keep them maybe in his pocket or in his car. Yeah, and he would keep them just in case he had to quickly put them in because somebody was gonna come and talk to him. And so when he came in, he said to me, I'm positive what I want is permanent teeth. And that's what we did for him. In just a few appointments, we were able to give him permanent teeth. And you know what he told me afterwards, Randy?
What's that?
He told me that him and his wife had not kissed in years because she would not kiss him because of his dental situation. And so he then told me that I reignited the intimacy in his life, and how powerful to be able to do that for someone.
Now, you're a dentist.
Yes.
So I'm sure you think that teeth are one of the most important things.
They are.
How important is the smile?
A smile is everything. It will boost someone's self-confidence. You know, people that smile are happier people. They usually make more money because they feel better about themselves.
Okay.
They're more successful. You know, when you walk around and you don't smile, people think you're miserable. People don't want to talk to other miserable people. People that are missing teeth or have really bad teeth or people that don't smile, they're stigmatized, Randy. They are most of the time people think, oh, these people are not educated, they're poor.
You know, we talked about like in the movies or in Hollywood, you want to make somebody look poor, you give them bad teeth.
Yeah, definitely. Just think about it. If I'm missing a front tooth, you probably are not going to want to speak with me, or you're just going to perceive me as a totally different type of person.
So in one day,
they
could come in.
Randy, I have had the other day a patient came in and he was driving by my office. He had never been into the office. He told me that he was on his way to Home Depot and he was missing a front tooth. And he said he saw the sign and he was just going to come in and ask.
Like a billboard. You have a billboard?
I do have a billboard, but he just saw the sign outside our office.
Okay.
And so he came in and he said he wanted to make an appointment. And that particular day I had time to speak with him, so I brought him in, and in just half an hour I replaced that tooth for him. And he just continued on his way, went to Home Depot, went to work. It was like a normal day.
How old can you be to do this?
There really is no age limit, Randy. As long as you are relatively healthy, you can come into my office, walk, you're a relatively healthy person, we could do this procedure on you. My grandmother, who at the time was 87 years old, she was just completely phobic of all dentists. The only reason she would allow me to clean her teeth was because I was her granddaughter, and she would tell me, you have to get me numb because I don't want to feel anything. And so my mom decided she wanted to replace the teeth that my grandmother was missing. And so she said to me, you're not going to tell her that you're going to place implants on her. You're just going to get her numb.
Your mother said, don't tell your grandmother that you're going to do an implant.
Right, because she's just so phobic. So we couldn't tell her. So what we decided to do is we were going to get her numb and tell her that I was going to clean her teeth. So in just one afternoon, I placed the implants on her, and she left with permanent teeth. And my grandmother had adapted to missing several teeth. She really didn't.
Like in the back? Like she was missing in the back?
Yeah, but she thought she was fine. She didn't realize that she wasn't chewing as well and probably not as well nourished as she should be. But afterwards, you know what she said to me, Randy?
What?
She said, I am chewing so much better now. I can eat so much quicker. She didn't realize how much time it was taking her just to chew simple foods. And once we replaced the several teeth she was missing, she was astounded at how much quicker she could chew, and certain foods she was able to, before she, like, for example, like nuts, she wasn't able to eat them as well, or it would just take her a lot longer.
Now it seems very painful. So you did that mini implant and she didn't even know she was getting an implant.
She didn't know. She thought I was cleaning her teeth.
Okay, so you finally told her, and was she in disbelief?
She asked me as soon as we finished, she said, what is that I feel in my mouth? And I said, oh, we replaced the teeth that you were missing. And she looked at me with this look of disbelief. She couldn't believe it. She couldn't believe she had done it.
So 87 years old is not too old?
Nope. She's diabetic, a controlled diabetic, but she's 87. And she's a healthy person. So
now, what about the people though that have bad gums? They have like gum disease. Can they still do this?
Randy, those are the ideal patients. Really, all we have to do is get rid of the diseased teeth, and the infection goes with it. So we take out the teeth that needs to come out, we clean up the infection, and we can place the mini implants into good solid bone once the infection has all been cleaned out, and they do really, really well.
Now, what about the denture that's been wearing a denture like 20 years? Isn't it true that you don't have enough bone to do this?
That's not true. I have many of the patients that I see, Randy, they have been told by many dentists that they are not candidates, that there's just not enough bone. And I can think of one specific patient that came to me after having seen maybe 8 or 9 dentists, and she was wearing a denture for about 40 years. Wow. She was newly married, and her spouse did not know she was wearing a denture. And she said to me, "We have to fix this. I saw your ads, and I came here because you said that you can help people that have had enormous amounts of bone loss, and that's me." So we took a CAT scan on her, because I have a CAT scan in the office.
All right.
And I was able to plan her case, and we placed several implants, and we gave her permanent teeth. So she sings in her choir at church, and she told me that she was in the 3rd row of the choir, hidden in the back, and once she got her permanent teeth, she moved up to the 1st row. She had a lot more confidence with her spouse. So many of the patients that I see tell stories like that.
So if other people, you said 8 dentists are all telling her you don't have enough bone.
And that's true.
So what are you doing that's different?
No, that is true given their experience and the technology they have in their office. So because we have the CAT scan, I can visualize the bone in 3 dimensions. For patients with very limited bone, mini implants are just ideal for those patients. They don't have to have that bone graft. They don't have to have that sinus lift. And in a non-surgical way, we can just place the implants through tiny pinholes in the gum and stabilize their denture or give them a permanent set of teeth. So there's a lot of hope for all those patients that have been told that they're not candidates. Because of mini implants and 3D imaging, those patients are now candidates.
Now, I spoke to somebody in your office, I think maybe your office manager, that said that they don't really need much numbing.
No, but I just give them
they don't need IV sedation.
Nope. We can just place some local anesthesia and just numb up the gum. There's no nerve endings in the bone, Randy. So as long as we can numb up the gum tissue, we can make those small pinholes and place the implants right into the bone.
How soon can they eat after the procedure?
That same day. In fact, I tell them, go home, make sure you eat. It's important that you're well nourished. Yes. And usually within a couple weeks, they're just whatever foods they want.
So when they're all healed up, they could eat whatever they want. They could eat crunchy things, chewy things?
Yes, peanut brittle. They can bite into a bagel. They can have that steak that they haven't had in years, the corn on the cob. I can think of another patient, Randy, that when he came in, he was missing many teeth. All his teeth had to come out. And he said to me, "I want permanent teeth. I'm sure of it. I haven't been able to eat well in years." And so we got started right away. So at every appointment, he would ask me, "Are you sure I'm going to be able to eat the steak? And are you sure I'm going to be able to eat the corn on the cob?" He couldn't believe it.
So he was afraid to eat.
He was afraid to eat.
He's got the teeth back, but still afraid to eat.
Still afraid. Yep. And so finally, once he realized that he could eat all these foods, when he would come in for me to check on him, he then started asking me for recipes. He would say, "Oh, so do you cook, Dr. Rodriguez? And so how can I make this steak? Or how would you make this?" So he went from being someone that was just in utter disbelief and did not believe he could eat all the foods that he wanted to eat, to then asking me for recipes.
Okay, good. Now we're going to take a quick break. We come back, more about the mini dental implant process, what they can expect on day 1. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I was wearing denture. I used to wear denture, and when I eat with the denture, the food would lodge underneath, between the denture and my gum, and I have to be taking it out to get the food particle out, and that was so gross. I wasn't able to chew my food properly, and swallowed that. I wasn't able to digest my food properly because I wasn't chewing it properly. I called the office, Dr. Rodriguez's office, and make an appointment, and I was here like a couple of days after. I had 10 implants done. 10. on the same day. That day I went home and I was okay, no pain, nothing. And in the next couple of days, I was like my good self again, my whole self, no pain, no nothing. And since I got my implant done, and I would not trade it for nothing. I love it. I'm able now to chew my food. I can eat anything. Driving to work, I can eat my chips. I can eat just about everything that I wasn't able to eat before. Now, since I have the implant, I don't have to take nothing out. I just chew. All I had to do was rinse my mouth out, and I'm good. After I came and put the Parliament one in, I am myself again. I mean, when I was in my 20s, because when I was in my 20s, I chew anything and everything and feeling good. Now, I'm back to my old self. I would not trade it for nothing.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. With us, we have an expert on the topic, Dr. Rodriguez. So you brought some photos.
I did, Randy.
And these are what? People that were headed to a denture?
He was actually wearing dentures.
Okay.
Well, he had the dentures. He didn't wear them because they were just so poorly fitting. And he came in and he said to me, I'm fed up. I no longer want to wear this partial. I want permanent teeth. So I showed him the models and I said to him, this is what the fixed teeth would look like. And he said to me, that is exactly what I want. I want to just have a lot of confidence and not have to take my teeth out. So we wanted to save the teeth that could be saved in his case. So we did some porcelain crowns on the top. We replaced the missing teeth in the back, on the upper, and then on the bottom, there was just no way he was gonna wear a denture. That's not what he wanted.
Okay.
So with him, we extracted the teeth on the lower that had to be removed, and in just one afternoon, he left with teeth.
Is that right? So a full arch of teeth.
Full arch of teeth.
Again, he can eat and chew or whatever.
Yes. Eat, chew, whatever he wanted, Randy.
Now the upper denture though has suction. So they don't
Right.
need the implants there because they're pretty solid?
Well, they think they like their upper denture, Randy, but what they don't realize is that their palate is covered, and a lot of your sense of taste comes actually from the palate. So we can place 6 mini implants on the upper, and because of the mini implants, we're able to open up the palate. And so the patients can feel the hot and the cold. And I had a patient that came in and said to me, when I drink a beer, I want to feel that fizz against my palate.
Okay.
So with an overdenture, because of the mini implants, we can open up the palate and they can feel hot and cold and just taste their foods a lot better. So they think that upper denture is not that bad, but they just don't realize the potential, how much better it can be.
So when it's all done, then they realize it's much better than the
much
denture
better.
they had before.
It's
on
much
the upper.
better. Yep.
Now in your office, we should mention, I guess how it's normally done, you go to one doctor that does the dental implants,
Right.
in your case mini implants,
Right.
and then another doctor that puts the teeth on top,
Right.
and then somewhere else for the imaging.
Right.
You do it all right there.
Yeah.
Even the imaging?
The patients don't want, even the imaging, the patients don't want to go running around to several different offices. One of the first questions I typically get is, can you do this? Can all the work be done here in your office? And when I say yes, that is what the patients want to hear, Randy.
Is it less expensive because
Yes,
you're doing both parts?
we can pass on the savings to the patients because we're doing everything in our office and they don't have to go to multiple offices. And the mini implants, Randy, are usually less than half the cost than traditional implants because it takes less time, and because it's less time and in the dental office, we can pass on that savings to the patient.
So if one of your family members was just missing one tooth, would you give them a mini implant or a regular implant?
I've done this procedure on several of my family members. In fact, my husband had a tooth that had a root canal twice, and the root canal was failing, and we redid it, and it continued to fail. And so I said to him, really, what we really need to do is just remove that tooth. And at that same visit, I took the tooth out, we placed the implant, and he got a tooth that same day.
And that was a mini implant.
That was a mini implant, yeah.
So what about pain for your husband?
Very minimal pain, very minimal. I took the tooth out, Randy, and he was asking me, have you taken the tooth out yet? And the tooth was already out and the implant was in.
Is that right?
That's right.
So they can't really feel it when
No.
it's happening.
No.
Now what about the downtime afterwards? Do they take
No,
medication or
he
what?
went right back to work, Randy.
Is that right?
He was in the chair for half an hour, including the paperwork. The tooth was out and the implant was in 10 minutes. It was that quick.
So if you're missing a tooth, even whether it's one tooth or all your teeth, definitely get mini implants.
Definitely. If it were my tooth, Randy, this is what I would have done.
So take me through the process. Patient comes in and they're already wearing a denture.
Yep.
Or the patient that you can't save their teeth, they have to have extractions. What are the options when it comes to mini implants?
So with mini implants, we can make them a snap-in, snap-out denture. So
Okay.
we just place maybe 6 implants, and we can make them a denture that snaps onto those implants. So it would fit much, much more securely than what they have. And not only are they going to have a denture that fits tighter, Randy, but the moment we place those implants, the bone loss stops.
Okay.
As long as you go without teeth or without implants, you're constantly losing bone. But the moment we place those implants, the patient's going to maintain that bone. And that's really, really important for them to maintain that bone. The other option is permanent teeth that do not come in and out. This is like their 3rd set of teeth.
All right.
And we place maybe 8, 10 implants, and we can make them permanent teeth that they do not take in and out.
And they can eat whatever they want.
Those patients are the happiest, Randy. They can eat whatever they want, and most of the time they will be able to eat foods that they haven't eaten in years. So the transformation in their life it's huge. These patients, usually the day they get their teeth and they're looking in the mirror, most of them cry. It's a very
Really?
They do. It's very. You and I don't think about this because we have teeth, Randy. But if you don't have teeth, your life is just completely different. Completely different. Most of the time, you don't socialize as much. You don't have the self-confidence. And when we give that back to someone, it's life-changing. This is the first day of the rest of their life. I was just at a conference and there was a patient there who had not had teeth in years. He basically didn't leave his house. He didn't socialize even with his own family members. And so he was going to get permanent teeth that day. And when we gave him the mirror after the procedure was done so that he could see the teeth in his own mouth, he started to cry. I could see that tear coming down his face. And the first thing he said to us was, I just can't wait to get out there and to start my life. It was like he was,
Nice.
Randy, that's what I see every day. We see it all the time.
Okay,
all
so
the
they could
time.
go snap in, snap out, or teeth that don't come in and out.
Right.
And how do they maintain them? So if they get the teeth that don't come in and out, just like regular teeth?
They're going to brush and floss. We give everyone a water pick, and they're going to treat them like their own natural teeth. I ask the patients to come in every 3 to 6 months just so we can check on them. But really, they're going to treat them like their own natural teeth.
Okay, and the upper, same kind of thing, snap in, snap out,
Yep.
or permanent?
Yep, or permanent, right. We have the snap in, snap out option on the upper, but if the patient wants permanent teeth, we can make them a permanent set of teeth that don't come in and out.
Is this the future of dentistry? That means whether it's 20 years or 50 years, that in the future nobody will have a traditional denture? That means they'll all be attached to something?
That's what I hope, Randy. I don't think anybody should have to wear a denture, really. If it's a family member of mine, or really anyone, I don't want to see anyone have to wear a denture. Really, I think they should all either be anchored to the implants, or it's really the best option.
Now, when it's all done, when they're healed up and everything, is this one of those things where they say, I should have done this a long time ago?
That's what most patients tell me, Randy. Most patients tell me that their only regret is that they didn't do it sooner.
Because people suffer with bad teeth, I guess, for many years before they actually do something.
They do, and
You told me.
they suffer in silence. They don't people will talk about having cancer, but they won't talk about having a denture.
Okay.
Denture wearers are stigmatized. They don't talk about wearing the denture with their family member. Most of the time, they wait for their spouse to leave to go to the bathroom and to clean their denture, and they start their day with having to put that dental adhesive in. Randy, I can tell you about another patient. She had her own dentist. She had a denture on the upper and another denture on the lower. And when she came to see me, her dentist had already told her that she was not a candidate for implants. But she came to see us anyway because she wanted hope. That's what she wanted.
Okay.
And so I said to her, I said, I can give you a permanent set of teeth in just a few appointments. And she said to me, my dentist told me that wasn't possible. And I said to her, with the mini implants, you do not need a lot of bone. And she had very little bone. And she was in disbelief in the beginning. And so finally she came back to us and she allowed me to start with replacing just a couple of teeth. And once she saw that it was possible and how painless and quick it was, she said to me, we are going to do my whole mouth. So today, instead of having a denture, because of mini implants, she can eat and chew whatever she wants. And this is a patient that had very little bone, and many dentists had told her that she was not a candidate for implants, that she would have to have bone grafting done, and she didn't want to go through all that. So within just a few appointments, we were able to give her a permanent set of teeth.
We're out of time, but final message, somebody watching this, and let's say that they are headed for dentures, their teeth are bad. And then the other group, maybe they're wearing a denture already, and they've heard what you had to say, but they're skeptical. Maybe they're afraid of the process. What do you say to them?
I want to invite them in. I'll tell them, come in, there is hope. We offer a free consultation. And I want to educate them about what their options are. There are options for people with minimal bone, for people that have been wearing denture for many years. There are options for permanent teeth, for a snap-on denture. We offer a free consultation.
Now, we should mention, and we're short on time, but that Medicare, Medicaid does not cover mini implants or traditional implants. And even with the best dental insurance, doesn't cover the whole thing.
Yeah, Randy, but we offer financing. So even if they don't have any coverage, which most patients don't have any coverage, most cases we will find a way for them to finance their treatment
So
and get it done.
if they have decent credit, you go through like a lender that's going to help them?
We work with 3 different financing companies, and we'll find a way for them to get this done.
So people are financing this?
Definitely.
Like every week?
Every day.
It's very common?
Every day, Randy.
So it doesn't hurt that much. You said earlier painless, but it's like...
It's minimal pain,
minimal
Randy.
pain. Okay.
Minimal pain. I would say very minimal pain.
But pain is not something they're really complaining about?
No.
But when it's all done, they're going, I should have done this.
Most patients are shocked. They afterwards they tell me, I thought this was going to be painful, and maybe they took some Advil or Tylenol that night.
That's it?
Really, we do give them a prescription just in case they need it, but I would say 80% of them do not need that prescription.
Okay, so and even if you have bad gums, they're qualified.
Definitely.
They still qualify.
Definitely. We take out the teeth, and the infection goes with it.
We're out of time. I want to thank you for coming on the program.
Thank you for having me, Randy.
Now, if somebody wants to make an appointment, they'll see you.
Yep,
they go to the
they'll see
website.
me. Yep.
Okay, good.
Call our office.
All right. So no more dentures.
No more
You're going to
dentures.
wipe them out in New Jersey?
I'm going to try, Randy.
Okay, thanks. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.